Hi, I'm Commissioner Zoe Metcalfe, Police, Fire and Crime Commissioner for North Yorkshire and York, and I'm Vice-Chair of the National Rural Crime Network. And here in North Yorkshire, I am continuing to work with our partners to better identify and respond to domestic and sexual abuse in our rural communities. This is building on the findings and recommendations that came out of the captive and controlled research carried out by the network in 2018. There is a phenomenal amount of work being undertaken to ensure our rural communities are safe and feeling safe, but here are a few examples. Last September, and in partnership with our stakeholders, I commissioned a project to review how domestic abuse is responded to locally within healthcare settings. North Yorkshire has a large rural area with a low population density, and this creates further risks and challenges for victims and survivors of domestic abuse. We already knew that rurality and isolation are used as weapons by abusers, but the reduction in GP practices has also reduced the support networks and escape routes available to victims. And the close-knit nature of rural communities also acts as a further barrier to accessing support, especially if their healthcare provider knows the abuser. So we're now working on an action plan to address the findings and recommendations of this review. And as a start, we're working with our healthcare providers, focusing on rural communities, identifying healthcare settings such as GP surgeries, community care coordinators, social prescribers and pharmacies to offer them specialist support and training to better identify and respond to domestic and sexual abuse. As part of our wider strategy to address violence against women and girls, we're also working with our partners to identify and explore other suitable locations where victims can easily and quickly access help and advice, and a safe place. So, for example, village shops, food banks, mobile libraries and supermarkets. But to tackle the issue head on, I have recently provided funding to contribute to a specially converted camper van to provide support to women in the rural and isolated parts of the county. So the service is able to bring advice and support to victims rather than having to travel to get support. And although the service has just started, we're already seeing the benefits, and it's been really appreciated by the people who've been using it. And our commission support service provider IDAS have recruited, trained and supported our extensive network of over 200 volunteers and community champions who have supported the development of new groups to support victims and survivors across the county. IDAS have also established a fully embedded, successful referral hub supported by the community-based multidisciplinary teams including domestic abuse practitioners, independent sexual violence advisors and children's workers. The referral hub enables the community-based teams to spend more time engaging with their communities, raising awareness and finding ways to engage with the seldom heard or marginalised communities. For example, in rural Craven, there is a practitioner who is dedicated to engaging with the older, isolated people. And in rural Rydale, there is a practitioner who's dedicated to coordinating a new whole community response to domestic abuse in rural areas. And lastly, the Protect Your Home scheme, funded by the Home Office's Save the Streets Fund, has upgraded the security of more than 3,000 homes, 200 farms in rural areas since 2020.